We're talking about the cardiovascular system, and now we're talking about blood pressure, and we're going to talk a little bit about high blood pressure. Before we do, let me just remind you that your body is constantly regulating your blood pressure because human physiology relies on this concept of homeostasis, keeping things in the sweet spot, not too high, not too low, just right. If things get too low, there are mechanisms designed to bring your blood pressure up. Whenever someone's lost a lot of blood because of a car accident or they're really dehydrated because of the stomach flu, that will cause their blood pressure to go too low, and these mechanisms bring it back into the sweet spot. The problem with high blood pressure is something mostly that's a problem with people later in life or here in our modern society a little bit younger because of the way we eat and our lack of exercise. But when your blood pressure is too high, some of these systems will bring things back into the normal zone. Remember, there are different parts of your body that were designed to be measuring your blood pressure and reporting it to your medulla oblongata, part of your brain stem, so your medulla oblongata can talk to your heart and tell your heart, hey, beat faster or beat more slowly. Let's talk about an endocrine system that is designed to regulate your blood pressure. There is a molecule known as angiotensinogen. And angiotensinogen is always there in your plasma. It dissolves in the plasma. It's always there. It's not doing a darn thing. Angiotensinogen is an example of one of those molecules like fibrinogen. Remember fibrinogen? Fibrinogen is not active while it's in the O-gen state, but if something cuts off the O-gen, it'll start to activate it. Angiotensinogen is like that. It's there all the time, not doing anything until your blood pressure gets too low. If your blood pressure gets too low, then the kidney will release this enzyme called renin. There also is a molecule in human physiology called renin. That's not this. This is renin. Just has R-E-N-I-N. And when renin cleaves angiotensinogen, it'll turn it into angiotensin 1. Honestly, angiotensin 1 is still not doing anything. Angiotensin won't do anything until this next enzyme called ACE turns angiotensin 1 into angiotensin 2. ACE, or angiotensin converting enzyme, ACE. ACE is found on the cells of your lungs, and when angiotensin 1 bumps into it, then it'll get turned into angiotensin 2. And angiotensin 2 is a vasoconstrictor. So it'll take your blood vessels that are this big and make them smaller. And when they are smaller, then it makes your blood pressure go up. There is a link between what we're talking about and this coronavirus pandemic that we're under. The virus that causes this disorder, COVID-19, that we're all stuck inside because of, the way it enters the body is because of a molecule called ACE2. So let's see the connection between them. So I just told you that ACE is angiotensin converting enzyme, and it is a protein, an enzyme, that is attached to the cell membrane of lung cells. And the job that ACE has is to cut angiotensin 1, turn it into angiotensin 2, and angiotensin 2 will cause your blood pressure to go up. So what is ACE2? It's a very closely related enzyme, and it is also found attached to the cell membrane of lung cells. And why is it there? ACE2 is there to inactivate the angiotensin 2 and make your blood pressure go back down again. But this dastardly coronavirus that is causing COVID-19, the way it enters the cells of your lungs is by attaching to the ACE2. So if you didn't have any ACE2 on your lungs, then the coronavirus couldn't get you. People with high blood pressure have more ACE2 on the surface of their lung cells. And this is one reason, we believe this is one reason why people with high blood pressure are more likely to get sick and severe symptoms from this coronavirus. So who knew, right? So blood pressure. One of the ways that blood pressure is going to go up or go down is by how stretchy your arteries are. When you are young, when you're your age, your arteries are very stretchy, so they can stretch quite a bit without the blood pressure going up. I want you to remember that blood pressure is going to be dictated by cardiac output. That's how fast the heart is beating, how hard the heart is beating, right? Blood volume, we will talk about that when we get into the urinary system. And then peripheral resistance, that is how big or how constricted your arteries are. And part of that is dictated by that story about ACE and angiotensin. I want you to memorize this number, 130/80. A person is determined to have high blood pressure when their resting blood pressure, like not right after you just ran in from the car or something like that, but when you're just hanging out, quietly sitting there, if your blood pressure is higher than 130/80, people will ask me, well, which one is the more important one? If either number is too high, if your blood pressure is 140/70, chronically, meaning many measurements, then you've got high blood pressure. If your blood pressure is 120/85, chronically, you've got high blood pressure. Please remember that number. It's on exam 3. So hypertension, high blood pressure. It is when your chronic resting blood pressure is above 130 systolic or above 180 or above diastolic. And what is the bummer about high blood pressure? Oh, by the way, high blood pressure is called hypertension. Remember in medicine, hyper anything is too much. So in this case, too much blood pressure. And it will destroy the small arteries. So you need arteries bringing blood to the back of your eyes, right? Those little tiny arteries, the little tiny arterioles in your retina, blood pressure's too high, they just break and you don't get enough blood to your retina and you don't get enough blood to your retina. It can cause blindness. Too much blood pressure also causes really high afterload, which makes it very difficult for the heart to push out any blood at all. And all of that pressure on the heart causes the heart to work too hard. And that'll damage the heart. Now, you might think to yourself, well, wait a minute, when I exercise, don't I make my heart work harder? Yes. That's a great question, by the way. Someone asked me that, and I was like, yeah, I got to look that up. So when you exercise, indeed, you do make your heart work too hard. But how long do you exercise for? Even if you're one of my crazy marathon running friends, you exercise too hard for 3 hours, 4 hours. If you've got high blood pressure, you're asking your heart to work super hard 24 hours a day, 7 days a week. Well, that's a totally different thing. If you exercise really hard and then you rest, while you're exercising, you stress your heart, but during all those hours you're resting, you allow the heart to build itself back stronger and better. However, with high blood pressure, your heart is constantly working that hard. It gets little bits of injury or damage, and it never gets a chance to repair itself, and your heart will start to fail. When high blood pressure damages the arterioles leading to your kidneys, it'll actually destroy the little functional units of the kidneys that are called the glomerulus and the nephron. We will talk about that specifically when we do the urinary system. High blood pressure, hypertension, also leads to heart attacks, and it can cause something called aneurysms. Make sure you memorize that. What is an aneurysm? Boy, aneurysm, that's just totally crazy to spell. Got to be of Greek derivation. Let's look at the image over here on the right. If we look at the image over here on the right, we see a normal aorta. Sorry, the image on the left, a normal aorta. If we look at the image on the right, we'll see that there's this kind of bulge on the aorta, and that is a depiction of an aneurysm. Let's imagine for a moment that I had here in front of you a bicycle tire inner tube, and I'm pumping it up with a little hand pump. And as you're watching, the bicycle tire pumps up and up and up, and it looks nice and full. And I keep pumping up the bicycle tire, and you start to get uncomfortable. You're thinking, Tidal, that thing's going to pop. Right before it pops, what's going to happen? One area of the bicycle tire is going to bulge out, and it's going to look a lighter gray color than the rest of the bicycle tire, and you know that thing's going to blow. That would be analogous to an aneurysm. An aortic aneurysm is tremendously dangerous. If an aortic aneurysm ruptures, even if the patient were on a surgery table under anesthesia when it blows, you may not be able to save that person's life because your entire blood volume would go out through a big hole here in a single minute, and that's just too fast. Can be aneurysms in the arteries going to your brain. Aneurysms in the arteries going to the brain are called cerebral aneurysms. And when they blow out, they cause a very disastrous kind of stroke that is very difficult for someone to survive and still have normal brain activity. But there could be an aneurysm in almost any artery. I don't know what's on. There we go. Now, don't freak out. I'm not asking you to memorize these drugs for high blood pressure, but I do want to show you how much you've learned in just this amount of time talking about the cardiovascular system. Drugs for high blood pressure are drugs that are designed to lower your blood pressure. And there are many different entire categories of blood pressure drugs. One of the categories are the ACE inhibitors. Remember, ACE is that enzyme that turns angiotensin 1 into angiotensin 2, and angiotensin 2 would cause an elevation of blood pressure. If we have a drug that basically binds to that enzyme and covers it up so it can't do its job, then it cannot turn angiotensin 1 into angiotensin 2, and that will help the blood pressure of many patients. So that's one way. And ACE inhibitors are less effective in some people than in others, and they can have a side effect of a dry cough, so they're not anyone's favorite blood pressure medication. Let's jump from there down to angiotensin 2 receptor blockers. Angiotensin 2 receptor blockers are called ARBs. They're particularly good for controlling high blood pressure in patients that have got type 2 diabetes. And ARBs are exactly what they say they are. Angiotensin 2 will cause your blood pressure to go up when it binds to something on the surface of the cells of your blood vessels and causes them to constrict. This drug covers up those receptors. So in that case, patients will have plenty of angiotensin 2 around in their bloodstream, but they cannot bind to the receptor, so they cannot cause blood vessels to get smaller, so your blood pressure stays lower and normal. Calcium channel blockers will cause your heart to beat more slowly and to be more mellow in the way it beats, which decreases your cardiac output, which also decreases blood pressure. Diuretics are actually several categories of drug that cause you to create a larger volume of urine. The more water you pee out in a day, the less blood volume you have, and the less blood volume you have, the lower your blood pressure will be. Look, I don't need you to memorize any of these. I'm telling you these for an important reason. When your family members have got high blood pressure, probably when they were diagnosed with high blood pressure, they felt fine. They went to the doctor said, you've got high blood pressure. And when the doctor said, you've got high blood pressure, the doctor put them on a drug to control their blood pressure. Now, keep in mind that your aunt, your uncle, your grandpa, your mom, they felt fine when they had the high blood pressure. High blood pressure is called a silent killer because it sneaks up on you. And so you won't feel that you've got high blood pressure until your blood pressure is insanely high. So people with high blood pressure, hypertension, they feel fine. They don't even know that they've got a problem. Then the doctor puts them on a medication. And I will tell you honestly, most of these medications are going to cause some side effects, sometimes temporary. Okay. So let's imagine your mom, she went to the doctor and she needed to go on something for her high blood pressure. Doctor put her on a beta blocker, and now she's a little bit tired. And she's like, this is stupid. I felt fine before I went to the doctor. Now I'm taking his medication and I feel worse. I'm just going to stop. Please ask them not to stop, right? It's called the silent killer, not just because it's silent, but because it's a killer. I will hear almost every semester of from a student who's got a family member that ended up at the hospital with heart failure or a stroke because of hypertension. So it's easy for someone you love to ignore their high blood pressure. Please ask them not to, but encourage them to go back to their doctor and tell them, hey, doc, I didn't feel good on that medication. Try me on a different one. This is not even a complete list of different whole categories of drugs that you can use for high blood pressure. I'll tell you one thing, that sometimes a drug like a beta blocker will make someone feel a little bit tired, but that'll be just for a week or two. After 2 weeks, they will go back to feeling normal. But if they don't, then say, doc, try me on ACE inhibitors, or give me some of them ARBs I've heard so much about, all right? So it's really important that when people have got high blood pressure, that they take care of it. I think we've got one more video. I can't believe it. One more, hopefully we'll be done. I'll see you in a little bit.